starts right now. Thanks for joining us tonight. I'm Doug Reardon.
And I'm Janice Allen. First at 10, when it comes to the COVID-19 pandemic, we're all looking for any kind of good news.
Yeah, and some potentially very good news was released today from the World Health Organization. Our Derek Francis joins us live tonight with exactly what they said, Derek.
Yeah, Doug and Janice, it has to do with the spread of the virus. And today, a question that came more than 30 minutes into the WHO's regularly scheduled presser has given many real encouragement now in the fight against COVID-19.
Dr. Maria Van Kerkhove of the World Health Organization responding to a Reuters article today stating that half of all new cases in Singapore show no symptoms, defined as asymptomatic, laying out some welcome news when it comes to this sometimes silent enemy.
We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare.
Very rare that people who may test positive for the coronavirus but don't show symptoms spread it to others, contradictory to what we've heard for months now as to why this virus is so difficult to slow. The data's so new, in fact, that it's not even published yet.
From the papers that are published, there's one that came out from Singapore, looking at a long-term care facility. There are some household transmission studies where you follow individuals over time and you look at the proportion of those that transmit onwards. We are constantly looking at this data and we're trying to get more information from countries to truly answer this question. It still appears to be rare that an asymptomatic individual actually transmits onward.
With this new data in hand, Dr. Van Kerkhove says they want to focus now on following the symptomatic cases, which could make a real dent in transmission quicker than previously thought.
If we actually followed all of the symptomatic cases, isolated those cases, followed the contacts and quarantined those contacts, but it would be a drastic reduction in transmission. If we could focus on that, I think we would do very, very well in terms of suppressing transmission.
Now, guys, Dr. Van Kerkhove did differentiate between mild or not typical COVID symptoms and truly asymptomatic. Also differentiating between asymptomatic versus pre-symptomatic, saying there is indeed a difference there, but still, either way, this could be some much needed good news moving forward in the ongoing fight against COVID-19. And Janice and Derek Francis, Fox 17 News.
And